can't be part of the healthcare ministry if you don't go to the doctor yourself. So it was an incentive for me to go to the doctor also, because it was a lot of things that I should have been doing, but wasn't. So I got a lot of information that was helpful through the healthcare ministry. When we have our blood drives or we have healthcare meetings, we do invite the community out, to the church, so that they too can be aware of their health. It's still in the process of getting everybody to understand and getting the community to trust you, to that whatever you say to us is confidential, and that's the most important part in the community, is getting the community to trust the church. Mainly getting to know different churches, and seeing other churches' ideas on how they're running their healthcare meetings and what they're doing in their health centers. Getting more information from different churches to help us. I really have to thank Sharra and Dominique for giving us this idea of a healthcare ministry, because it has made, we have had exercise classes, we have done diabetes classes, we have done a lot of stuff, and it is so important for us to know all of this stuff. It's not that we didn't know, it's just that we wasn't aware. So this program has enlightened me as, part of the healthcare ministry, and I'm talking to people, even people I don't even know, about, checking themselves and check your medicine, how are you feeling, what symptoms are you having. That is stuff that I wouldn't have done before.
I would say the impact that the Community Health Leadership Academy's grant over the last 4 years with Grier Heights Presbyterian Church has been a very positive one. It has allowed us to grow within our ministry. Our ministry, now we participate in all different activities within the community, as well as provide health information to our congregation and community that allows African Americans to see that the health topics that we present are for their benefit and for their good and upholding the body and temples. The significant change, I would say, is the members that get excited on the third Sunday. We present the health topics, and they also get excited when we have different things that we have, projects that we have organized within the church. They look forward to seeing what's new, what's coming, and what all we can do to help with health disparities. We've gotten a lot of the youth involved as well as their parents, and I've seen those changes. I want to share an experience at Grier Heights that happened back in September of 2009. We received the grant for the Diabetes Project, and we had the event after service, and we did glucose checks, and one of our members' glucose level was extremely low. And we sent that member to the urgent care and followed up with her afterwards, and everything was fine. However, she let us know that because of what we did, she found out she had an underlying problem, and that really helped, because without having the glucose check, she would have never known. So as far as the Community Health Leadership Academy, we want to thank Sharra, Dominique, Ron Fair, and Dr. Mead, because without that member of our congregation would not have known that she had an underlying problem, and we just really want to thank them for that.
The impact with the partnership and faith has been phenomenal. The information that we give out every first Sunday is geared toward the month. Like this month is National Minority Health Month. It's also, the last Sunday is Go Pink. So we talked about the health issues that affects minority. And we talked about the breast cancer awareness. And to be able to get up once a month and give that 3-minute talk about whatever the issue is, be it blood pressure, diabetes, hypertension, cholesterol, it's made a magnificent impact in the church. Church memberships now are more aware of what they eat. They're more aware of the amount they eat. They are more aware of what they're doing to the inside of the body and realizing that, just because it looks good doesn't mean you have to have it. You can choose to eat things in moderation. So it's made a big impact when we connect the food and the health and the history together. The church has started to eat healthier. And this one particular Saturday, I was diligently changing my board and putting information on the board. And one of the seniors walked past, and the senior said, "You spending all that time changing that board. Child, don't you know they don't read that?" And it kind of hurt my feelings, and I stood there and I said, well, you know what? If one person read what I'm putting on this board, then I changed one person, hopefully. And so, she went on about her business, and I'm sitting down thinking, ooh, And so 3 months later, I was standing outside in the foyer, and she walks up to me and she said, y'all getting up on Sunday and telling us to go to our doctor and get our physicals and eat healthy, and just kept nagging at me. And I went to my doctor. She said, he told me my blood pressure was up, my cholesterol was up, and I was pre-diabetic. I said, oh. She said, but you know what? I've lost weight. My blood pressure is down, my cholesterol is down, and I'm not pre-diabetic. And she said, thank you. And she hugged my neck. And I said, you know what? It's worth it. It's worth it.
In 2002, we planned and held our first health screening. In the process of planning for the next year, we considered doing mammograms, basically because there were several people in our congregation who were breast cancer survivors, and their cancer was discovered very early, so they were like 5 and 10 years cancer-free. And doing some screenings, one-on-ones or what have you myself, I discovered that our women were not getting their mammograms for various reasons. Some of them had problems with insurance, and some of them had problems with the exam itself. So our ministry decided if we were able to get the mammogram unit to come to the church, that we would probably be able to get more people involved in getting their mammograms done. I was one of those who was screened, and my mammogram was positive for early stage in situ breast cancer. This was really an eye-opener for all of us, because being a nurse, I had religiously done myself breast exams and had my mammograms every year since the age of 40. And I was so happy to know that other people in the church were able to get their mammograms done at that same time. And I think we had one other person who had a false positive. I am now 5 years post-cancer, and I recently had my 5-year checkup, and I'm cancer-free. We also partnered with the Free Medicine Clinic, and this is how our church really got involved in health screenings. Donna Lacey was able to tell us how she was already working with the health department, and that the health department was very, very involved in community health issues. So I was introduced to Sharra Emanuel, and Sharra Emanuel, who I love dearly, was very, very enthusiastic about community health. And I just really get excited when I even think about the fact that it's been this long. I didn't realize it had been this long since Jenkins had been involved with the health department. And, I prayed every night that, I would be involved in some health, community health issues that would really impact our community enough to get other people involved. We also got involved in the men's prostate cancer initiative, and it's been very rewarding very rewarding. And I really can't say enough about this program. I really can't say enough.